Hello, doctor. Thank you for this interview opportunity. I am Dr. Akin. I have graduated from Dhaka Medical College Hospital, completed my MBBS course on 2021 of August. Following that period, I started my internship training in the same medical college hospital, which consisted of placements in medicine, surgery, and gynae. After my internship, I had developed a keen interest in general surgery and a special attraction for this subject. And after my internship, I applied for the BMDC registration, the registration in our country. After obtaining the registration, I was looking for my first job, particularly in the accident and emergency, just to keep all the clinical practices that I did during my internship. So, I also had plans in completing PLAB since I had fascination to start in the NHS. I am interested in doing the training over there. So, as per my plan, I started my job as an emergency medical officer, which is the F2 equivalent training period in accident and emergency of Parkview Hospital, where I found multitude of cases of medical surgery and other orthopedic cases. So my main role as an emergency medical officer was to receive the patient, take a thorough detailed history, doing a focused examination, particularly in association with the patient's history. Take some social history as well, and take some allergy history, and then we do the give the initial management, the basic management, so as to resuscitate the patient. If there is any sort of hemorrhage, we need to control the hemorrhage, and also we need to see follow the patient as per the ABCDE protocol, the CRISP protocol, starting from securing the airway, breathing, circulation, and any sort of disability. Okay, and also escalating it further later for the definitive management to our seniors like registrars and consultants if available. Okay, so this is I did this work for almost 10 years. I did this job for almost 10 years continuously without any gaps, and so far there's no gap. The only 2 months I came in the United Kingdom to attain the PLAB 2, and also during that period I did a clinical attachment which I want to mention in this interview session. So, my clinical attachment in Medway Maritime Hospital was quite enlightening in terms because I get to know about the trust values which actually resonated with me. So the thing is, I attended ward rounds during my clinical observership. I have observed how an SHO clerks a patient in the ACE deck, in the wards, and also how they present it to the consultants, how the consultant gives their input to the SHOs, how the collaborative management I have understood about it, which was very beautiful thing, and I strongly believe this actually increases the patient compliance. Okay. So I also saw the relationship between the doctors and nurses were quite excellent in terms like everyone knows and understand their roles in their clinical practice, and the patient management is quite prompt in terms, and the work-life balance is excellent over in NHS, especially in the Medway. And I also have some of my colleagues back in my country who later worked in Medway. I have found out later, and I had an excellent time uh, watching all of this happen. So, Doctor, this created quite a fascination for this institute, and I would love to have an opportunity to work with your team. And I've also heard about the surgery team as well. It's an excellent team, and I surely want to be a part of it. So, this is my resume. And about my academics, what I have done a research work during my third year med school, which involved like I have collected data on the vaccination dropout among a fixed amount of population children in a definite area of Dhaka district. So it consisted of creating a questionnaire and go like taking interviews, filling up it, and found out that most of the people are quite there was busy housewives, and most the level of education, there was some issues with that. So we arranged some teaching area sessions in that particular region, and also we made up a paper. It was a collaborative effort as well. And about the audit, I'm glad, I'm delighted to mention that I did a audit during my clinical observership, which was on the usage of antibiotics in urinary tract infection. So what I did, collected data from the SDEC, and also from the words, and compiled it in a PowerPoint presentation. The poster presentation was also done. So this is all about my general surgery uh, experience. Is quite enlightening in terms, like I have seen quite a number of trauma and casualty patients in our accidents and emergency department, which I resuscitated. I actually controlled the hemorrhage, and assessed the site of lesion, site of like cut injuries or abrasions, uh, provided dressings as well. And in the wards, I have actually now my current designation being a medical officer in Apollo Imperial Hospital. I'm seeing the patients on day-to-day basis, and also doing the dressings and taking the detailed history, doing the soap maneuver, taking doing, yeah. This is all about it. Thank you so much.